Assalamu alaikum and welcome to this week's Journal Club, where I'll be presenting a paper by Patel and colleagues published in 2026 in the IAJ, titled The Survival and Success of Teeth with External Cervical Resorption, a multi-center retrospective study. So the objective of this study was to evaluate the long-term survival and success outcomes of teeth affected by ECR, managed via 3 distinct treatment strategies using periapical radiographs and small field of view CBCTs. And they used that for diagnosis and treatment planning. The secondary objective was to explore associations between demographic, clinical, and radiographic variables in treatment outcomes. For the sample size, they had an initial sample size of 305 patients, but they finally ended up with 233 patients and a total of 296 teeth. For the methodology, it was done in accordance with the probe statement across 5 endodontic specialist practices, and they took diagnostic assessment including both periapical radiographs and small field of view CBCT scans for every case, and the ECR lesions were classified using the Heathersay 2D and the Patel 3D classification systems. There were 3 treatment strategies. The first one was the periodic review, where there was no active treatment. It was chosen for asymptomatic inaccessible lesions or those showing bone-like repair. The second one was the external approach. A mucoperiosteal flap was done, elevation was done, and excavation of the resorptive tissue and restoration using composite resin or resin-modified gloss ionomer. And this was done either with or without vital pulp therapy or endodontic intervention. The third treatment option was the internal approach, done by endodontic treatment combined with the internal repair of the ECR defect. And the follow-up was conducted on an annual basis. For the outcome criteria, success and failure and survival were all recorded. And for the results, the follow-up duration, it had a mean of about 3 years, and the overall estimated survival rate was 95% at the first year, 93% at 2 years, 85% at 5 years, and 80% at 7 and 10 years. For the survival by treatment type, the first treatment, which was the periodic review, had a success rate of 93%. The second treatment option, which was external approach, had a success rate of 90%. And the third treatment option, which was the internal approach, had a 59% success rate. For the failures, overall 25 teeth failed, 13 due to the ECR recurrence, and 12 due to non-restorability. There are also risk factors. Mandibular teeth had a significantly lower hazard of extraction than maxillary teeth. For internal repair, the third treatment option, it was associated with statistically significant 7-fold higher hazard of extraction compared to the periodic review. So in conclusion, teeth managed with periodic review showed the highest estimated survival rates, likely due to inherent biological repair mechanisms and case selection. And also active interventions resulted in higher extraction rates, with external repairs proving more viable and demonstrating more favorable survival outcomes than internal repairs. Thank you very much. Finally, I just wanted to say there are some limitations of this study. It is a retrospective study, so there are inherent limitations regarding the data gathering, the intra-examiner reliability and assessments. There was also a high attrition rate, a severely declining recall rate over time, and only 4.4% of teeth contributed data for the past 7 years, dropping to 1% at